Hello and welcome to the Reflection Show with me, Martha and Spice. We want to have an amazing conversation. There are times that our parents or even our relatives who are getting old or who are older might have some health complications. Sometimes we don't know where to take them to or even how to take care of them. Today, we want to look at palliative care, how we can take care of our relatives who are of age or who are at old age so that they would live longer for us. Let's go for a break. When we are back, we have a great conversation. Stay tuned. Hello and welcome back from the break. Like I said earlier, we'll be having a conversation on palliative care so that you and I can take better care of our aged relatives or our aged parents. I have here with me a palliative care specialist here at the Tamale Teaching Hospital. You know what? She is the first in Tamale to be a specialist in that field. I'll let her introduce herself, then tell us all that palliative care is all about. Thank you very much for joining me, madam.
Thank you for having me.
Tell us your name.
My name is Margaret Borian.
Okay.
I'm a palliative nurse specialist at the
Okay.
Tamale Teaching Hospital.
Great, great. Let's go straight. Palliative care, what is it all about?
Well, palliative care, like you rightly put in your introduction, is one aspect that you've mentioned. Palliative care is a broader sense of caring for patients
Okay.
who have been diagnosed with a terminal illness.
Okay.
So even if a child is diagnosed of a terminal illness, the child qualifies for palliative care.
Okay.
Also, patients who have been diagnosed with a disease that limits their life or threatens their life, they also qualify for palliative care.
So it's not just the elderly, like I said earlier on, but anyone
Exactly.
who has any terminal. So just briefly, what is a terminal illness?
A terminal illness is a disease that you are diagnosed with, which science probably says they don't have a cure to it. So it means that you are going to live with that disease till you die.
Wow.
So for example, cancer. Cancer has no cure. They only
Okay.
manage cancer. So once you are diagnosed with cancer, the remaining years or months or days you have, you will always have cancer. And so you will live with cancer. Palliative care will take care of you till you
Okay.
die.
Wow. Wow. So it means that whether a child, an adult, whether you are male or female, just when you are diagnosed of any kind of terminal illness, then you are, how do I say it, like a palliative patient. So how do you say it? Is there a term like that?
Well, we don't like to tag them as such, but then you qualify for that care once you are diagnosed with.
Okay, so
with the,
what is different from the normal kind of care? So if I have malaria, etc., what's just take us through the palliative care, the processes, everything, and how does one even get a palliative care? Just take us through the journey of
okay.
all that.
So palliative care is actually new even in Ghana.
Okay.
It's started in Ghana in 2008.
Oh,
So it's
okay.
not so old. And in Tamale, I'm the first person to have gone for that specialization.
Wow.
So, like I said, it's all about caring for a patient who has been diagnosed with a disease that has no cure. And so the disease comes with its own problems. It comes with so many stresses on the patient, on the patient's family, relatives, and friends. And so the different thing that palliative care adds to the normal care we all know is the fact that it takes care of the patient and the family.
Okay.
So
Okay.
caring for a patient who has been diagnosed, with a serious illness, the relations also go through a lot of stress. And palliative care will not just take care of only the patient, but even the family members.
So what
So
kind of care is it? Like, is it that you help them take their medications, or just explain the process of that kind of care?
So usually, terminal illness, there's a lot of pain. People
Okay.
who are diagnosed with these diseases, they have a lot of pain. And pain also is not just the physical pain that we all know of. We have psychological pain, we have spiritual pain, we have social pain. So
Okay.
palliative care is more of a holistic
Okay.
care. It will dig into all these things, get the problems that are arising from all these angles that I've mentioned, and then addresses them, tries to manage those problems.
So what are the stages? So if someone is diagnosed, so if today someone gets diagnosed of either cancer or sickle cell or any of these terminal diseases, what is the first step they have to do, or the relative have to do?
So this platform is a good one, letting people to know that there is palliative care that you as the patient or the family can even opt for.
Okay.
That is if the physicians are not even referring you for palliative care. Once you know that there's this other aspect of care that can be given to me, you can ask for it. So, but then when you are diagnosed, when you are first diagnosed of it, we are taking care of the symptoms that you are presenting, because the disease doesn't have a cure.
Okay.
But you will present with some symptoms. There will be pain, you will have fatigue, you may vomit, and all other symptoms that is arising. So palliative care will take care of them. And like I said, it's not just the physical ones I've mentioned. If patient has psychological problems, is depressed because of the condition, palliative care will take care of those needs as well. We'll assess you, get the problems, and once we are able to identify the problems, we're able to give a solution. Sometimes we are not able to, for example, pain, take away the pain completely, but we'll try to relieve you of some of the pain.
So are you supposed to be there with the patient 24/7, or how? Like, um, how are you supposed to be with the patient? Does the patient come to the hospital, or you are employed to be in their house to take care of them? How is that done?
Okay. So palliative care can be practiced in so many settings. One is the hospital. If the patient is on admission and then needs this care, the hospital, the team will attend to the patient whilst the patient is on admission. If the patient is discharged home, she can have an appointment to come back to the hospital and see the team on OPD basis. So
Okay.
you come, we see you. If there are medications to take, you take, and you go, we show you how to take the drugs at home. If patient can't come to the hospital, then we offer home service. So, but that one comes at an extra cost, because the team will have to move to your house. So the patient can opt for home care. We move to your house, we'll assess you, identify the problems, and then we care for you in your home.
Okay. Is it expensive? Let's start from that as well.
I won't say yes and no. It will depend on where you stay. Of course, if we have to move from the hospital to your house, the distance will determine. But I don't see it as costly if you really want to provide comfort for a patient at home. Sometimes you are looking at even the risks of transporting the patient to the hospital. And some patients want to be nursed in their home. So for that comfort, I will not say that that is costly.
Most times when people are diagnosed of these terminal illness, they are scared that they will die and all of that. What role does palliative care give to the patients who are, let me say, psychologically afraid? You mentioned that as well. So in detail, how does that play a role in keeping them alive?
So palliative care, we don't postpone death. That is to say, if patient should die, we are not trying to avoid the death. Likewise, we don't hasten it. So patient probably can be given some painkiller to relieve the patient of his pain, and then we are not giving it. So we don't hasten death, neither do we prolong it.
Okay.
We just allow science to take its place. So of course we all will die. It's the when nobody knows. For me, I always say that it's even good when you know that let's say somebody is able to tell you that in the next year you will die. It helps you to put your house in order. You get it? Unlike you are not aware it comes to take you. So for me, I see it as a positive.
You are preparing for your death, kind of.
Exactly. You are able to plan, when I die, I want this, or when I'm so sick and I can't talk, do this for me, don't do this for me. They are all part of palliative care. We call them advanced planning. And so we plan with you, for the future, and then you give your directives. This will be like a legal document that's in instances where you can't talk. This is what I want you to follow for me. So advanced planning is part of palliative care. So like I said, everybody will die. And so we are only trying to help this patient who has been diagnosed with a disease that hasn't gotten a cure to be as comfortable as possible. We want to improve the quality of life of that patient so that as long as the patient is still alive, the patient should be comfortable.
Okay. Now, in detail, what makes palliative care different from the normal kind of care that we have? Sometimes people also have their relatives supporting them. What makes it different from the specialist perspective? What do you do different?
So what's different with palliative care is the fact that we don't deal with only physical symptoms. We deal with the physical symptoms like pain. We'll manage pain, so we'll give medicines for pain. And then other symptoms, psychological, social, spiritual. People have some spiritual beliefs that they sometimes think is because of that they are sick. We're able to address those problems, bring in whatever belief. If it's a Christian, we can bring in the pastor.
Yeah.
If it's a Muslim, we bring in the imam or whoever can help the person in that direction. So palliative care actually is a teamwork.
Okay.
So as we see the patient, when this problem arises and we need another specialty to come in,
Okay.
we invite the person
Okay.
to also come and address that problem.
Okay. Okay. So it means that you are an advanced version of relative care that they give us. Let's say your family and friends, the kind of care that they give you.
You can
Okay,
say
let
that.
me come a bit personal. What really made you to want to go and study this and even become a specialist?
Wow. So my dad died suddenly,
Oh,
and I didn't get the opportunity to nurse him, as a nurse before. And so that thought has always been in my mind. Imagine he was sick for a long time, and I'll go and inject him, I'll give him drugs, that joy. I miss that. So I said, no, if I miss that, let me give that opportunity to other people who will be sick. So that actually was my starting point of wanting to care for people who are dying, people who are suffering, and then that suffering is going to lead to dying. So that they got the opportunity, like I've mentioned, to put their house in order. They have someone somewhere to forgive. You give them the opportunity whilst they are still alive to forgive the person. They are in pain and you are able to reduce their pain for them. They have issues about their God and their beliefs, and you get them to understand. You get them to understand even how their disease is progressing. So it doesn't surprise them when certain things are happening to them. So if I tell you that cancer has no cure, and so you expect that you'll be tired, you expect that you will not feel like eating, there will be pain, there will be times you don't want to even talk to anybody.
Yeah.
You explain all this to the patient and the family. So when patient begins to be in pain, that will not surprise you, isn't it? Because, okay, the disease, that's how it progresses, and there's no cure for it, but we are managing it. So at a point the patient is in pain, what do we do so that the patient's pain calms down and she's a bit comfortable? So that's what palliative care will do. At a point, patient wants to talk. Who is around to listen to the patient so that the person makes herself available to listen? At times, the patient wants to just be quiet. Can you just give her space to be alone? Palliative care will be able to take care of all this because we do thorough assessment.
Okay.
So when I see a patient, you see me asking, oh, where do you stay? How many children do you have? Do you have a best friend? What are your hobbies? And all those informations help us to identify if there will be problems even along the disease.
So now I see that uh, p- until I got in touch with you, I had never really heard about that before. I just saw few people taking care of ageds, like in videos, even not in Ghana. Like these are nurses or maybe in movies that they take care of them. Now, how has the response been like since maybe you came out from school, you are not a specialist, you're not trying to give people this awareness? Are people accepting palliative care? Are people now getting to know about it? And do you think that it is something that Ghanaians, or especially because you are in Tamale, people in Tamale will adapt?
Well, looking at my location culturally, I'm seeing that there might be a few challenges.
Okay.
Because from this part of the country, or not just even this part, a lot of people don't like to talk about death. So you can imagine if so many people are not comfortable talking about death, and then you want to talk about it because you want to provide comfort for the dying.
Yeah.
So it's going to be a bit challenging. That doesn't mean that there isn't a solution. I believe that until you start and you start moving, you will not get a solution. So yes, I've started, I think, first week of February.
Okay.
So it's not quite long. So I'm not able to probably give a vivid response that it is either going on well or not. But even with the health professionals, sometimes when you mention palliative care, what comes out is end of life, the person is going to die. But it's not always the case. There are patients who have been under palliative care for more than 5 years.
Wow.
So it's just to improve your quality of life. And once your quality of life is improved, then you can always, you can always have the disease and still go on with your life. So if your pain can be reduced, and let's say you are a teacher and your pain can be reduced and you can still go to the classroom and teach, why not? But you are sick. You are a trader and you can still go to the market and sell whilst you are having this disease, why not? So it's to improve patients' quality of life.
Okay.
Basically.
Now let's come a bit to children. Or young people. That has always been my concern. The two most common illness that people easily get that affect all age groups are sickle cell and cancer. Now, with sickle cell, it can be so severe. In children, just help us give some tips to maybe some parents who might be watching us and may not even have palliative care specialists in their community. How can we even ourselves as relatives? Because like you said, if you come and tell me how to help ease the pain and I don't want to, I'm not going to do it, even though I have the specialist. Because if you come and do your job and go, and the family members who are around the patient do not do their job, at the end of the day, whatever you are doing is zero. So what role can relatives play in helping their family members who are going through these issues and having or need palliative care? One, with a specialist. Two, without a specialist.
So when it comes to the children, of course, when they are under 18, their parents play a key role also. So we don't take away the parents. It's like what the patient wants is what we will do. We will explain to you that if you do it this way, these are the advantages and these are the disadvantages. Then we put it before you. You make that choice. So once we explain to you that with palliative care, we could get your pain reduced, we could improve your quality of life, it's now left with you to say yes or no. If you say yes means you want us to be part of the care. And when you invite us to be part of the care, we'll just do what we can do best. For the specialist care, actually what's happening now currently as we take care of patients, every nurse, every doctor kind of has learned a bit of palliative care. So what is happening now is they are trying to relieve you of whatever symptoms you are currently having. But what differentiates the specialist care is that we take care of more complex issues. So when the disease is progressing, like I said, it comes with its own problems. There's a lot of stress that comes with the disease, and the family is usually affected. So the specialist then takes care of these complex problems that arise.
Okay. I want us to go for a break, but I believe that this conversation is opening up our minds because especially in Ghana or in Africa, this is something that we don't even pay serious attention to. We'll be back.
Topics like dynamics of kingdom influence, dynamics of ministry, Marcus King for church workers, money matters, and she calls herself a woman. This marriage must work. No more curses, loaded mouth, secrets of kingdom dominion, the exploits of service. Things fall apart. Church without bleeding pulpit, singles mingle, and many more.
Welcome back from the break. We are still looking at palliative care, making sure that you and I understand how we can take care of our relatives, whether young or old. Before this episode, I thought that it was more about the aged, but now I'm understanding that even children can or deserve palliative care when they have been diagnosed of any form of terminal illness. Now, let's look at the day-to-day activities, the day-to-day roles that relatives can play in helping their relatives who have been diagnosed of this terminal illness.
Okay. So we will educate these relatives on what to do. So how to give the medicines, we'll give you that education.
Okay.
If it's lifting the patient, if let's say the patient can't walk and you have to do the lifting and turning of the patient in the bed, we teach you all these techniques. We teach you what kinds of food the patient should eat, at what times you should eat, what to avoid, you know. So basically, it will be like a health education we are giving to these relatives or parents or the caregivers, let me put it that way, those caring for the patient. So that at home where we are not going to be there 24/7, you can take up that role and do for the patient to keep the patient comfortable. So basically, the patient's relatives will be to teach them, you know, to also understand that this is the disease and how it's progressing. This is how you can care for the patient. You can give the drugs this way. If you are seeing these signs and symptoms, it means this. If you are not comfortable with these signs and symptoms, you can report to the nearest hospital, you know, for admission, and then care will be given to you at the hospital. So basically, this is how the patient's relatives or caregivers come in.
Okay, you mentioned something about sometimes inviting other specialists. So depending on what the patient needs, so you can invite a nutritionist, you can invite a psychologist. So all that depends on what the patient needs.
Exactly. What problem she's presenting with. So if in my assessment, I realize the patient is very sad, I'll call in the psychologist because that is also his field. So the psychologist will come in and be able to address that sadness. If patient is, you know, having some nutritional deficits, the dietitian and nutritionist will be called in. What kinds of food should this patient eat? At what times should the patient eat? And what quantities should the patient eat? If patient is, you know, still diagnosed and maybe in stage 1 of cancer or stage 2 of cancer, where other curative measures like chemotherapy or radiotherapy can help comfort the patient, then the oncologist is called in. So they come in and they can give the chemotherapy, and all these are geared towards what? Making the patient comfortable.
So now, when it comes to children, let me be a bit specific on children. Sometimes you're not even able to talk or express the pain. How do you diagnose that, or how do you help them in that?
So with children, the parents are key players in this. The parents will help you because they are with the children 24 hours and they will know. Aside that, with pain in children, we have a tool we use.
Okay.
If it's depending on the age, I can show the child, you know, some pictures for the child to, you know, pick up a
certain
face,
objects
and that will indicate this
certain pain
pain scale. So it depends on the age range of the child. If it's a toddler who cannot speak, certainly it's from what I will see and then what the mother too will be telling you. But if it's a child that can speak, a child that can point to things, that understands that a smile is this and then a frown is this. We use pictures and we're able to solicit their level of pain, and then we care for them.
Wow. Now, in adults or the extreme aged people, sometimes it's not that they have any terminal illness, but old age has caught up with them. It can just be the normal body pains, they can't walk. Sometimes the normal thing can just be BP is a bit high. So with that one, is how does the care goes? Because they are not, there's this other is it amnesia or something? I've forgotten that there's this um condition that one moment the patient is acting all happy or this way, the other moment the parent can even be very rude. I've forgotten the name. Maybe you can help me with that. I've seen certain videos of that where I think an old lady was even bullying the caregiver, and another video too, they were playing and somebody was like, it's a condition that the woman was suffering from. So with that, how does palliative care help in that regard?
Okay, so with the aged, it's also another specialty on its own,
Okay.
geriatrics. People go and
Okay.
learn about, old age and then
Oh,
all that it also comes with. Like you have
okay.
mentioned, as you age, then the waist pain, the body pains, they also come
So
in.
that one too is
So
different.
that is another specialty on its
Hey.
own. But palliative care actually is about a disease that you've been diagnosed
Okay.
with, which hasn't got a cure.
Okay.
So if you are aged and then you have been diagnosed of that condition, then you will falling into palliative care.
Okay.
Aside that, if it is just a healthy old person
That just needs
that is
care,
presenting
yeah.
with all these and needs some care, then there's a whole specialty. People
Oh,
specialize
hey,
in
I
that.
thought it was the same thing.
So
Oh, so even if you are old and you don't have a terminal illness, you are not qualified for palliative care.
No.
So palliative care is whether you are young, you are old, but you have a terminal
exactly,
illness.
you have a
But even if you have just old age symptoms and you need care, it's not
it's
palliative,
not palliative care.
That one he said is what?
Geriatrics.
Hey, wow.
Geriatrics, yes.
Wow, thank God I asked this question because all along I thought it all fell in the same category.
No.
Now, when it comes to, let's take some of the common things that you encounter. Do you encounter people with sickle cells, cancer? Can HIV be qualified as?
It is.
Okay.
So we have the cancers, the end-stage organ diseases like end-stage renal disease. We have the heart failures, the sickle cell disease, diabetes. Any condition that is not reversible. If you have malaria, we can say that we can reverse it. Once you finish taking the drugs, then you don't have malaria again. But if you have cancer, they can't
But that one, can
reverse
someone also qualify for palliative care?
malaria.
Yeah.
No, please.
Okay.
No, please. But if
That one,
they-
it just care. It just care
yes,
for.
so
okay.
they'll cure you. Whatever they are giving you is to cure you so that you are free from malaria.
Okay.
But with those other conditions I've mentioned, HIV, AIDS, cancer, end-stage renal disease, heart failure, diabetes, sickle cell disease, there won't be a point that you will not be sickle cell again. You will always be sickle cell till you die. And so once you will be having that disease till you die, then you fall within palliative care.
Okay, so let's look at the stages of the care when you are diagnosed, the first few months, or let me say the severe stage, then maybe the time where you might need your caregiver once a while, and just take us through the stages. Or do you always, like, every day need your caregiver at all times?
So we have 5 stages. When you are diagnosed, you'll be in the stable stage. So patient comes, and even at that stage, we are still trying as much as possible to cure you. So what are the things that they can do to probably stop the disease or limit it a little? So that is a stable stage. And we have a lot of people in this stage.
The stable stage, that's like the first stage after meeting.
After diagnosis.
Diagnosis, then you now meet your caregiver.
Yes.
That's, you call it the stable stage.
So the patient, sometimes you can look at the patient and not know that the patient is even sick in the first place. So you are having a disease and you are just like any other person walking. So that's a stable stage. But as the disease progresses, then you go into the unstable stage. So that is when you begin to be falling sick and you need admission. You are not able to do a lot of things for yourself. That's the unstable stage. Then from the unstable stage, the disease starts to deteriorate. So you are getting worse. Even as we are trying to cure, trying to provide you the comfort, take away your pain and all those things, but the disease is still progressing. It is something that is moving on. So in the deteriorating stage, you see that most times patients will be hospitalized or will be bedridden at home and so on and so forth. Now from that stage, you move on to the end of life. That is, you begin to show signs that you will die. Signs like, you are sleeping all the time, you can't do anything for yourself again, you are getting angry when you should not be angry, sometimes no appetite at all, or some will eat more than they used to eat. So there are a lot of signs, difficulty in breathing will come in at that stage. So those are signs of what? End of life. And then of course, end of life will lead to death. And when you die, the last stage is bereavement. Your relatives or caregivers will bereave. Palliative care will take care of their bereavement, because some people bereave abnormally.
Wow.
You lose a dad or you lose a mom, and where the normal is
that's also something you do. Like people, wow, like when they are bereaved after their funeral and burial, you have to still meet their family.
Yes.
Oh, take us through that.
Yes.
What are some of the things you encounter in that stage?
So in that stage now, the patient is no longer there, but it's the family. Because during these stages, if patient is really referred early when patient was diagnosed, you see that you have a relationship with the family. You can't just cut it off like that because the patient has died. So you still maintain that relationship with the family. And whilst that relationship is ongoing, you are trying to still find out, are they, grieving well?
Because is there a well way of grieving?
Of course, everybody will have a style, but the standard is there. When you are going off board, it means there's also abnormal and you may need some help. So we journey with them through that period, so that if any of them is exhibiting an abnormal grieving, we'll come in and help.
Bereavement. Yes. Well, I've never heard that there's a well way of bereaving. So now let's look at what do you consider, one, in looking for a palliative care nurse to take care of yourself or your family or relative? What are some of the things you need to look at for the best? And even the facility or the hospital. So let's look at the specialist themselves, like the person and the facility. What are some of the things that patients or patient relative should look out for in choosing the facility and in choosing the nurse?
So this is a difficult one. But so for now, you'll be looking at which hospitals are probably practicing palliative care now. Like I said, it's new, so you don't have so many people who have gone to do this specialty. So if you want it, then you have to be looking out for which hospitals are having it now. If it is the home care you want, and then you approach, say, the palliative nurse, then we are looking at your home also. Are they, basic structures, for us when we come to your home to care for your patient? If your patient is at home and there is difficulty in breathing, do you have oxygen at home? If no, then we can't probably provide.
So with the facility, does it mean you have to carry the patient to the hospital every now and then to meet the palliative?
Okay, so that's why I said if you are on the hospital, you are already on admission, and they refer you to palliative care, we'll come and see you at whichever ward you are.
Okay.
If you have been discharged home and you need to come and see for review, that one you come as an outpatient basis, so we'll see you after that, you go home. But if it is something that you want as a person, you are not referred by any doctor, but you just want a palliative care, after listening to this.
Or even like you were referred, but you want the home care instead of coming to the hospital.
Yes, so even if you were referred and you want the home care, so like I said, we'll come to your home. But there will be, let's say, there will be some things that you may need at home to help relieve your pain. So if patient is at end of life, and we'll explain to you that, patient might be having difficulty in breathing. It's a sign that, you are nearing death. And you are not comfortable with the fact that you are just at home and this patient is struggling to breathe. You see that a lot of people will not be, it's like you are not doing anything and you are just watching me to die. You are not comfortable with that. You can still always come to the hospital where you can have oxygen given to your patient. That is if it is the patient's wish. You know, elsewhere in the world where palliative care is advanced, like I said, patient has written down the directives. If these signs are clear that I'm nearing death, don't give me oxygen. Don't give me IV line.
Just let me die.
Yes, just let me die. They have written it as such. So, but this part of our world is not
Why?
yet. But this part of our world is going to look awkward that you are standing there
You'll be
and
seen
doing
as
nothing.
the enemy or the devil.
Yes, so you are standing there and doing nothing, and I'm dying. So that is when, you know, you will need to come to the hospital, and then we'll provide that comfort for you. So if, like I've just cited the example of difficulty in breathing, you can't see somebody really struggling and you are just watching.
Just
So,
because
but if
the
you get
person
to the
said-
hospital setting, they may put oxygen, you know, if it is secretions that are blocking your airway, they may siphon it. So that will provide another form of relief for the patient.
Wow. Hi, I'm asking this question again. Is it expensive? You mentioned that all of these things, the oxygen and stuff. If the home care, is it expensive? Or that one, it also depends on the kind of terminal illness and the things needed, right?
Yes, but I would say it's not so costly. So because I'm still beginning in the hospital, we have not yet put prices to these ones, but I can talk for, you know, where I trained. So for example, at Kolebu, a home visit is not more than 200 cedis.
Okay.
You know, there you have to talk of traffic and all those other things they factor in. And then it's not just sometimes, it's not just one person who also goes. Maybe
Okay.
2 or 3, a team that will
Okay.
go. So all that one is factored in. So it's not more than 200 cities, but I think it's not also less than 100 cities. So it's between that bracket. That is for Kolebu, where I trained. But for Tamale, like I said, we've not yet put prices to it, but
that.
I think it will be a bit less than what I've mentioned.
Okay. Now let's delve a bit into young people themselves who may have some of these illness, but I don't know if I should say they don't care or they don't understand what it is. The terminal illness, I want us to briefly explain the severity of it, because people know, oh, I have HIV, oh, I have sickle cell, oh, I have cancer, but they kind of live a normal life. What makes it severe that they need to have care for it?
So, you know, the normal continuum of care is that let's prevent a patient from falling sick. So that's when the public health will come in. You know, sleep under a mosquito net, don't drink alcohol, don't smoke, and all those things, so that you don't even fall sick. But of course, we will still do these things. Then we'll fall sick. When you fall sick, then they are trying to kill you. They'll give you all the drugs that can reverse the disease and send you back to your normal state. If that fails, that is when palliative care comes. So for me, I would say that it's good to, you know, do routine checkups for the young people. Do routine checkup, get to know your state of health. At least once a year, you can go for a full checkup, know the state of your kidney, know the state of your liver, know the state of your breast, the state of your blood. You know, you do everything and you know that this is where I am. You see that most of the times the cancers, they report at a very last stage. But if they came very early and they cure it, you know, using chemotherapy or radiation, you are fine and you can live longer.
I think I heard of a young boy. The mom was being interviewed on TV, and she said that the child, I think, was it born or something with cancer, something like that. I think he was less than 5 years. He went through chemo and he's now fine.
Exactly.
So the chemo can completely take out the cancer?
So the chemo is to shrink the abnormal cells and then stop them from multiplying.
Okay.
But when you present at a late stage where the cancer is probably spread to other parts of your body, then it's difficult to use chemo to shrink those abnormal cells. But if you just start something small somewhere and you report at that stage, you see that the treatment will work so well because it's targeting a particular location to shrink it. So that's why we keep advocating for report early, report early, report early.
We need to check ourselves regularly and also report early of any symptoms. Let's take a break. Welcome back from the break. This conversation is really opening my eyes to a lot of things, because at first it's just like when you are sick, just get someone to take care of you and you are good to go. But if you actually want to have a very effective health care treatment or care, you need a specialist. And they say they are called the palliative care specialist. Yeah, so yes, we have some few minutes to go, but I just want to talk about the fact that, yes, so you started talking about children and the chemo and all of that. Now, HIV/AIDS, suppose sometimes feel that, oh, HIV is no more as it used to be. Why should we still be worried and still ask people to check? And why do we still think HIV is a palliative care need?
Yeah, it is because it has no cure. The drugs they take are just to kind of manage the symptoms, that they are also presenting. So yes, once there isn't a treatment for HIV/AIDS, they fall under palliative care.
Okay.
And they also have their own problems.
Okay.
We still have stigma issues in Ghana.
Wow.
And when people are diagnosed with HIV, they don't want others to know. They are keeping it to themselves and all that, and they know that they will die with it. So all that psychological trauma that they also go through, they need some care, someone to care for them as they are presenting with all these other symptoms aside the physical ones.
Okay. So now I'm just taking you back a bit, because we're about wrapping up, just for the most important things. Just give us tidbits on parents on who have children who have terminal diseases. What should they know about some of these care, and what can they do? Aside, I think we've handled the relative aspects, but let's look at parents and their children, because at that time they are very young and the burden is on the parents. What should they know about palliative care, and just general education you'd want to give to parents who are listening to us?
Okay, so for parents who have children that have conditions that cannot be cured, and you think that your child is going through so much pain, many other symptoms, the child can't even go to school in some instances, you can opt for palliative care. We'll take you through, we'll let you understand how your disease is progressing.
Autism is a part.
Autism, yes. Okay. Autism, yes. So we'll take you through what to expect, from the disease. And once you understand it, you are able to care for your child well. Like you are saying, you are going to be with the child 24/7. So you need to understand that this is what will happen if I do this, and the disease is progressing this way. And then when I get these symptoms happening, it means I should give this drug. If child is doing this, then let's report to the hospital, and so on and so forth. So you understand and you are part of the care. And when it's that way, I think you provide, comfort and, relief of pain for your child.
Okay, because I see that a lot of parents who have children with autism really struggle, because I just can't imagine having a child with autism, because it takes a lot of, it's like having a child with sickle cell. Your life is practically on the child, everything that you do on the child. So in summary, in everything that we must know about palliative care, what are some of the things that maybe I have not asked you that you want anybody watching us to know?
Well, palliative care, when you hear it, please don't think it means end of life. It does not only mean end of life. Palliative care simply seeks to improve the quality of life of a patient who has been diagnosed with a terminal condition. And I've listed those conditions: sickle cell, HIV/AIDS, cancer, end-stage renal disease, heart failures, and many others. So once patient has this, it doesn't matter the age of the patient. you can opt for palliative care. If your primary caregiver, is not probably referring you because at that point he still wants to, give you treatments that could cure you, but you could ask for it, you could ask for some explanation. What of palliative care? Then they can refer you for that care. If you want home care, you can always ask for it as well. I want you to discharge me so that I can be home. And once you are home, the palliative care can come there and do for you what you would have been in the hospital and and be getting. But if at home you don't have certain things that can provide comfort and you can afford, like I've mentioned, oxygen. If you can afford oxygen at your home because you will need it, to provide comfort, why not? You can get them. Otherwise, if you don't have them and then some of these symptoms are presenting at home, you can still always come to the hospital to be cared for.
How do people get in touch with you if people in Tamale especially who need your services? So she's the first in Tamale who is a specialist in palliative care. So we all need to support her. We all need to have her educate us, especially for those of us that might have relatives or children who have any of these terminal disease. It might not even actually be getting her every day, but probably just meet her on 1 or 2 occasions. Just let her, I think I like the component you mentioned was educating the family about the condition of that relative who is not well. So if each and every one of us who have some of these illnesses can do as much as possible to have her in our homes, it will go a long way to ease the burden on the patient and also on the patient's family. How do people get in touch with you?
If you are in Tamale and your patient is in Tamale Teaching Hospital, that's where I'm there. I work there. So you can always have me there. It's just about asking your doctor that you want to see the palliative care nurse and they will refer. If they
What's the name of your department? Because TTH is very big.
So palliative care, because we take care of patients all over.
Okay.
All our patients are in all the departments.
Okay.
If it's a child, he'll be in the pediatric ward. If it's an adult.
But I mean, do you have an office or some part where they can easily have access to
Okay, so
you?
for now, you can find me at the medical department.
Okay.
If you want me, you can find me at the medical department. Specifically, first floor.
Okay.
I'm always there. Okay. I'm always there from Monday to Friday.
Okay.
Yes.
Okay.
But if you need home service too, then you can contact me personally on my telephone number
out.
So you can contact me on 054 221 5504.
Take your time and mention it again.
The number is 054 221 5504.
Okay, so if you want home service or special education, even as a corporate entity, as a corporate body, if you want her to educate your staff on some of these things, you might even have some of, let me say, the staff there who might have some of these diseases. I think the staff should be able to know that, okay, my colleague has this and how do I relate with my colleague and all of that. So we should all be able to have her in our homes or in our offices or wherever to give us that kind of education. I have been speaking with, please, her surname is a botanical name. She's my slave, so I'm trying to mention her. Is what?
Bor and Margaret.
Bor, that's for the Margaret I can mention. You heard the surname. So Madam Margaret, she's a palliative care nurse specialist at the Tamale Teaching Hospital here in Tamale. So anytime you are looking for her, she has given out her contact details and then get in touch with her. You can also follow us on our YouTube channel, Martha Inspires, Facebook, Martha Inspires Foundation, Instagram, Martha Inspires Official, Twitter, Martha Inspires Official, and LinkedIn, Martha Inspires Foundation. Just when you type Martha Inspires, you see the other options all coming up. And our WhatsApp number 05495785512. You can see them on your screen with our email. If you have any inquiries to make, even on this episode or any of our other episodes, or you want to get in touch with her in case you missed out on the contact numbers that she mentioned, we are always available to connect you with her. Thank you for watching this episode. I believe that it will make a great change in you and your family. I'll be back with thoughts. Stay tuned.
My name is Sule Barika. I'm from Yawako community. We came here for the Lead Decide program in collaboration with the Plan Ghana. As we came here, we learned a lot. We learned about self-determination.
My name is Mahmoud Rita. I come from Guabulga. I came here for the Lead Decide program. And when I came here, I learned a lot of things. Things like I learned how to determine myself, know my weakness and strengths. And I really appreciate and say thank you to Matter Inspire Foundation.
My name is Faisal Faiza. I'm from Banu community. We came here to learn about self-determination and self-weakness.
And due to that, we learn about our strengths and weakness points, what we know, what we like, and what we dislike in order to help other people. So thank you, Matter Inspires Foundation.
Hello and welcome to Thoughts from Martha Inspires. Today I want to talk to you about what I have captioned. You need to get yourself checked. We just had a conversation about palliative care, and a lot of times it's because people do not go to the hospital early enough to get their body checked. 2 weeks ago I went to the hospital, and one funny thing that my doctor said was that we actually check our cards more often than we check our bodies as a person. I think that we need to make a conscious effort to go to the hospital. Let's go and check ourselves. 2 days ago, a friend of mine called me, and you know what happened? He has to break out of his relationship of about 2 months because he is AS and a girl is AS. But if he had checked himself, he would have known and asked the relevant questions before he went into that relationship. We are causing ourselves a lot of problems, a lot of issues because we are not getting ourselves checked. Today, make a conscious effort. Go to the hospital. I know times are a bit tough, times are a bit hard. It is better to actually spend money, treat yourself once, and get better than to continuously having to spend money on hospital bills that may have no cure. You and I need to stay strong. You and I need to stay healthy. So I encourage every one of you, especially young people, please do well. Please do your best to go to the hospital to check yourself because we need you alive. We need to grow and glow. How can we do that if we are not healthy? Please, let's take advantage of even this health screenings that some NGOs or Ghana Health Service usually organize from time to time. Hepatitis B, HIV. Some of us are even scared to check for HIV. We are scared to check for sickle cell. We are scared to check for cancer. But the consequences of these actions or not checking early are so severe that we cannot afford to risk it. I believe that you are inspired, and I believe that you will do your best to get yourself checked together with your family. Thank you for watching this episode on Thoughts from Martha Inspires. See you next week. Have a good night.